We are very happy and with the initiative and the partnership that is taking place with the geography of our province. We've got a problem that in our province that then we've got districts that are verified as Umkhanyakude. As now we have this partnership then with the private sector, then we know for sure that all the patients that are in our province, they will get then the same quality of treatment wherever they are. With all then the regulations that are in place now, then we know for sure that wherever you are, then we don't have a fear that you say we don't have advanced life support as much. We do have a shortage of advanced life support in the province, but then with the private sector then as well, then be on board with us. We know that most of our patients then are going to be receiving the high care that then is expected out of them. Also then it's also helping us then in terms of then improving then PC re-engineering in the district level. Then when then you know that a certain patient then have to go to the clinics, but we know for the fact that in terms of the response time, if we do have then the partnership then with the private sector, they'll also do those transfers, use those interfacility transfers, which then is going to be giving us enough time then to focus then to more of then emergency cases on the road. So we really appreciate the initiative that has been done by the private sector. We are saying we are looking forward then to other people then to come on board then to assist us as a department, so then we can make sure that universal coverage then is done it's achieved within the province, because that's something that it's missing. One public sector ambulances cannot then service all the people that are there in terms then of getting the services on time and also then to get the quality. So then with this initiative, we are appealing to other people then out there to say, please come on board, let's work together. And we are happy with the EMS regulation that has been implemented, because that is where then we have seen that we've got so much skills that are out there that we were not sure of. Now we know that all the private ambulances that are in the province that are operational, they're being licensed, they're being inspected. So then we rest assured then all our people to say, when you see an ambulance on the side of the road, you must know that you are going to get a quality service. As from now, we are launching then the online application system for the EMS regulation, which is going to be saving a lot of time and consuming of time and paperwork that needs to be submitted, because now then we are moving with technology. You are going to be just then downloading the system wherever you are. Even you can be in Khanyakude, there is no network, or Zululand, there is no network, but then you can just download your document, upload your document, and then the document then sent straight to the server. Then the server then someone's going to be opening your email, then just say, okay, these are the documents from this private ambulance or this provincial ambulance, and then they'll assess everything. Then they'll just respond back to you within a space of a day. They'll just be telling you that there are missing documents that you need to submit. Then moving with technology, I'm really pleased with this because then it's been the first thing to happen in our province to have the online booking system, of which then I'm going to be encouraging all the private ambulance and the provincial ambulances that please, guys, this is about time. Let's move then with a digital system, and you don't wait for the last moment to submit a document. So then we can just then have our ambulance then rolling on the side of the road and treating our patients.
We have been working in partnership with the KZN province since around 2011. We have a funding which is to support the national HIV and TB responses in the province, and also health system strengthening initiatives which would help strengthen those services. HIV and TB are amongst the biggest health challenges that the country is facing and that the province is also facing. But an important aspect that's been recognized, that you cannot really provide effective support for these kind of programs to improve access without good health system strengthening initiatives behind those services. So this partnership is part of many services that we're doing. Currently, we're serving 4 districts in the province, but we have also been the provincial support partner to the province. And one of the important things that we've been able to do in this partnership, working with the province and the office of the DDG, is to be able to ensure that we provide the best use of technology support to be able to improve the efficiency, effectiveness of the service. So what we've been able to do, all of this is critical, that patients are able to get early access to care, and that then improves the health outcomes that they receive. And as you know, there is a broader initiative which is based again on a strong health system, which is to ensure that we optimize access to universal health care at the end of the day for universal health coverage. So all of these investments are part of that process. And what we have done is we want to build the support that we are getting currently through the generosity of our funders, is we also want to help build sustainable initiatives which can then help government move forward in a way that will provide this effective service. You need to be able to get patients to hospitals early, at the right time, and all of that requires services which meet a certain standard, which standard then gets defined, and they're able to be accredited right from the level of your clinic, your district hospital, even your emergency services and others. And so we hope that this investment, which then gives an example of how that kind of support can be done, which is essential, as I explained, for the very services and the diseases that we are trying to deal with. And as a province, I think with the indicators that we are seeing, they are amongst the best in the country at the present time. So we hope that investments of this nature and support of this nature, which is really focused on building a strong health system platform for the delivery and sustainability of these services, will then enable government to have had examples of how this can be done, so that you are leveraging this funding for these programs to strengthen the health system, and then give government a way in which you can move forward in a sustainable way. And we hope that initiatives of this nature will grow and spread in the province, and then also, of course, provide examples elsewhere, so that in the end our targets towards universal health coverage, which depend on strong TB services, strong access to other health services, and for instance with CCMDD have been leveraged to support non-communicable diseases. That's the whole principle of health system strengthening, where you get a disease investment, disease-focused investment, which then is able to strengthen the health system. The whole purpose of universal access is that nobody gets left behind. And that is why then you need to start from how you get to the health facility, what services you have at the facility, and how we can then improve efficiency. But our job is to provide examples from which government can then move forward in a sustainable way with implementation of these programs. And we hope that is what will come out of this kind of partnership. So we've been very fortunate in, as I say, having a leadership with foresight that has worked with us, guided us on where some of the priorities lie, so that in the end, then we can be able to reach the kind of targets that we have seen on the TB program side, maternal and child health, and other services where we are involved.
We walk to the front, confirm the registration number that's equal to what's on the system, and then we verify the current license discs in terms of Department of Transport. See whether the vehicle is roadworthy. Okay, we're going to start off with the equipment. EBM sizes. If it's available, then I just tick it. If it's not, then I'll leave it blank, and I've got an option to if I need to.
Differences in size adults, neonates, and infants. So then it's a matter of connecting oxygen, then it will be work properly. That's why I'm looking for all three cases that have been detected. Yeah, but normally do not connect because I know the equipment, so I just look, then it's there and happy.
Then the next item is the suction unit and the manual suction unit. Do you have a manual suction? No. Two types of suction units. A manual suction unit, which is operated by hand, which uses backup, because that one there is electronic, so it works by a battery. So if there's something that fails, then there's always a backup to use with a hand. So in this instance, they don't have the hand operated one. So I've just written here no manual on the comments. And then what we do in terms of the electronic equipment, we record the make and the serial number, so that it's logged on the database, and the system then automatically flags if it is picked up at another company somewhere else or another base.
The same
So the same serial number, it verifies that, so that if we come across the same serial number again somewhere else, then we need to query it. It could have been purchased. We need to establish the background to it. Yes.
And so this is the system that you're using to do all that.
That's correct. So on this particular item, the make, I have to report the make. That is scary.
But the system has got a risk control management in it.
And then we take the serial number. Ventilator.
Oxygen.
The serial number when you're ready.
1686.
Long splints, collars.
Yes.
When we click on a company, then it brings up, it's got a map to say where they're located, and then it gives a GPS location and the physical address and the municipality that it's situated in. And then there's a question here, are you currently at the location? If you hit yes, then it records the GPS coordinates on where we are actually located, and it keeps it in the database.
The next is the McGill dispenser rolls.
Okay.
Normally they keep it in the back.
Oh.
They keep it with the monitor itself.
Okay.
Let me just show you.
Okay. Pulse ox, separate small one, or from the monitor, or both?
There's another one.
I have two monitors, but this one has a built-in USB cheaper. Here you go, sir.
Okay.
Off the
And then
monitor.
let's do the ECG. Philips.
Philips. Serial number.
Hang on 1 second. Shops container.
Container.
So that's basically to verify that we have done the
Inspection has
inspection.
been done.
And then once we've completed, we hit the complete, and then it saves it into the tablet. And then we've got a function that says sync data, which is over here. Once we've completed, we hit the sync data, and it's got a SIM card inside, and then uses the data, the network, to sync the data back to the server. And then if there's any inspections that have been scheduled for us to do, then it syncs the data up to the server, and then the information of where we need to go next, it syncs down to the tablet.
Can you just explain if there is no network, it's a gift period, what happens?
if there's no network, then as it is now, it's saved the tablet itself. So once we get to an area where there is cell phone network, then you just hit the sync, and then it does it. And then it'll actually give you a status to say sync complete, and then you can see that's done. And then if we hit sync now, the information from the 2 inspections will be sitting on the server. So from the administrative point of view, from the office, they can actually log into the system and actually see our completed inspection within minutes after we've done it.
Let me take this opportunity to extend our appreciation to the Health Systems Trust for their contribution in assisting us as the Department of Health to realize our objective. In the World Health Organization 6 pillars of a healthy system, the Health Systems Trust has actually already contributed in 2. One, building a strong capacity in our clinical interventions, especially focusing on our HIV and TB programs in the province of KwaZulu-Natal. But when we're actually analyzing the achievements and the milestones that we have actually realized towards universal health care, we have realized that for us to achieve on the intentions around the strategic health programs, we need to build strong systems. We may do a lot on leadership development as a department, but we needed the partner like Health Systems Trust to contribute in building the strong pillar on the health systems development. And we took a decision to then say, let us also take advantage of the digital development in the platform in improving our referral systems so that whatever we do find a sync and a synchronized in a good health system that is complementing what were our interventions in the clinical space. So we really appreciate very much your support. We've been working with the Health System Trust for years. We're focusing on the clinical aspect. And yes, of course, the decision to then say, let us get to the pillars on which our clinical interventions are actually based on needs to be improved. We really appreciate for that contribution, and we're looking forward to more of such partnerships. Now we've realized that we can't do things alone. We need the private sector, we need the non-governmental organizations, and we need to have systems that integrate the private and the public sector as one. We're servicing one constituency. TB does not discriminate, HIV does not discriminate. Access to services is required by all, and therefore the need to then have this troika, the non-governmental organizations, the private sector and government working together, developing systems that are going to improve the health outcomes in the province of KwaZulu-Natal. Thank you very much for the contribution, and we're looking forward to sustained partnerships in improving the health outcomes in the province of KwaZulu-Natal. Thank you very much.